As of Friday, 96% of the population in England lived within 10 miles of a vaccination site, and we're expanding the number of vaccination sites further right across the whole of the UK, with the devolved NHS responsible for delivery in each of the 3 devolved nations, Scotland, Wales and Northern Ireland. This expansion will include community pharmacy and roving vaccination centres, on top of the hospitals and GP practices and the 7 mass vaccination sites that we've opened, including the one I visited earlier today at Epsom. This huge expansion means that by the end of January, everyone will live within 10 miles of a vaccination centre, either fixed or roving, in England. And this will help us make sure that everybody can get access to the vaccine that's so important. This stark fact explains why we must, while this crucial work takes place, each and every one of us must keep pushing back against this virus by following the rules that are in place. Please do your bit and help keep the NHS strong while we roll up our sleeves and make this ambitious plan a reality. So please stay at home to protect the NHS and save lives, either fixed or roving in England. And this will help us make sure that
we're in a sprint from now to February as those top 4 priority groups are offered their vaccination. We'll then kick off another sprint up to April as we get the rest of the vulnerable groups protected, and then finally a marathon to the autumn as we deliver vaccination to everybody else. Alongside social distancing and following the hands, face and space advice, these vaccines are our best line of defence that we have as we continue this battle against coronavirus. Should be in no doubt that this fight is tougher than it has ever been. Since Christmas Day, there are 13,000 more patients in hospital with COVID-19. And less than a fortnight into 2021, the number of people in hospital with COVID has already gone up by 1/3, a rise of around 8,000. We are seeing stubbornly high levels of infection and, unfortunately, death too, which is the sadly inevitable consequence of the rapid spread of the virus in recent weeks. Hospitals throughout the country are now seeing significant and sustained pressure from those rising numbers of COVID-19 patients. Even in the area of the country with the lowest number of patients, the South West, has more people in hospital now than the entire country combined did at the end of September. And with hospital admissions typically occurring around 2 weeks after transmission of the virus, we're still to see the full impact of the Christmas loosening of restrictions reflected in those hospital numbers.
And my colleague Gavin Williamson, the Education Secretary.
This is an extremely serious moment for the country. And as good news as the vaccine is, it cannot be seen by any of us as a free pass to ignore the national guidance. So as we mark another important milestone in the rollout of the vaccination programme, today we have to keep our focus and our resilience as a country.
This disease coming down. But those who are in there... So it is okay to go for a long walk or a cycle ride or exercise, but stay local and please get out there and take exercise because it's good for you, it's good for your physical and mental health, but don't say that you're exercising when really you're just socialising. Go and do exercise with somebody else because that's what the rule is there for, and it's there to support people, and we really don't want to have to tighten that further. Had the vaccine. We hope that we very much hope it has a... So I can rule out removing the bubbles that we have in place. The childcare bubbles, the support bubbles are very important, and we're going to keep them. I know how important they are to people, and they're an important part of the system that we've got to support people whilst also having these tough measures that are necessary